Hi everybody, welcome back to the channel. Today I have great news for anybody with diabetes who's considering pregnancy or anybody with gestational diabetes who's already pregnant, and that is that continuous glucose monitors or CGMs are now available for pregnant people. Whether you have gestational diabetes, type 2 diabetes, or type 1 diabetes, a continuous glucose monitor can really help save you from finger sticks throughout the day and help keep you in range or help you keep better track of your glucoses. And more information allows you to make better decisions about medications and diet and help improve your baby's outcome. On the plus side, CGMs can monitor your glucoses every 60 seconds for 24 hours. They generally record many values and store them. Some brands store them for up to 8 hours and some just continuously monitor, and you don't even have to scan your sensor. It will automatically send to your reader device or to your cell phone. Some devices even will send your glucoses directly to your provider if they have the software that can receive those values. So that means fewer phone calls, fewer emails, and text messages between you and your provider, fewer messages on the portal, and just an easier way to communicate your glucoses to your healthcare provider. Pro number 2, all this information is helping us improve outcomes for pregnancy. And one particular piece of data that's being looked at is what's called time in range, or TIR. What we recommend is that for type 2 diabetes and gestational diabetics, stay in range. In other words, not too low, not too high, within specific parameters 90% of the time during pregnancy. And type 1 diabetics, we recommend that they stay in range 70% of the time. So all of the devices that are currently being produced generate data that will tell you what your daily average values are and how much time you're spending in this specified range. And those data help us to predict which babies are going to be bigger, which babies might have a problem with low blood sugars after delivery, and help us just improve the outcomes for you and your baby. The third advantage is that you don't have to do so many finger sticks. There's still a role for glucometers and finger sticks, even if you have a CGM, but you don't have to pull out all that equipment and stick your finger 4 times a day, fasting and 2 hours after meals. On the downside, potentially, these devices can be somewhat costly. I know that before my insurance covered it, I was paying $75 every couple of weeks for one of these sensors. If your insurance covers it, though, you're golden, and more insurance companies are covering these devices even if you're not taking insulin for your diabetes, and more companies are making these devices. And I think that the more widely available they are and the more companies that make them, the more the cost will come down. The second potential downside is that you might have some sensitivity to the adhesive. So these are devices that stay on your arm for up to 10 to 14 days, and if you have an adhesive sensitivity, then this may not be for you. You might not be able to use it. And the third potential downside is that you don't completely stop doing finger sticks. If your device is telling you that your glucose is out of range, either high or low, or is rising rapidly or declining rapidly, you'll still need to do a finger stick. And these devices don't save you recording your glucoses. So I still like to have my patients scan their device and record their glucoses fasting and 2 hours postprandial, because that helps us make medication adjustments to see where your glucose is in relation to a meal. So to sum it all up, continuous glucose monitors are revolutionizing how we take care of patients with diabetes in pregnancy. So check with your provider and see if you might be a good candidate to use one of these, and talk with her about the pros and cons. CGMs make it so much easier to live life as a diabetic, but you still have to do the work. You still have to eat right. You still have to check your glucoses and check in with your provider. These just make it a lot easier to do that.